1470 and 95.3 FM, the Health and Wealth Radio Network. Pull up a chair at the Brooklyn Cafe with Dawn and Freddie S. Weekdays at 1 p.m. WNN.
When our air conditioning system went down last summer, we were lucky to have a neighbor in the air conditioning business. Phil Thomas AC and Heating, 50 years family owned and operated and always reliable. Phil was at my house in no time. The problem was my AC coils were clogged with dirt and algae. Phil explained that an AC system is like a car. If you want it to run effectively, you have to have it cleaned and tuned up periodically. Phil removed the AC coils, gave them a professional acid wash, and then tuned the entire unit. When he was done, it was blowing ice cold air. And the fact is that 75% of the service calls performed by Phil Thomas AC are completed on the initial visit at an average cost of under $100. Phil Thomas will never sell you an AC unit you don't need, and the prices are always low. Phil Thomas AC, call 954-434-4576. Tell him Steve Kane sent
Talk here. Talk there. Talk 1470 AM and 95.3 FM, the Health and Wealth Radio Network. WNN.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show. And it's been quite a year so far. It's a little time to reminisce, kind of look back at the year we've had, kind of a year in review. And one of the things that we haven't had yet on this show, as you know, we've had just about everything else in cardiology, oncology, neurology, orthopedics, etc. We've never had a sitting hospital CEO on the show, so I'm going to cut through my normal long-winded intro and get right to it. We have the CEO, Chief Executive Officer of Florida Medical Center, a campus in North Shore in Fort Lauderdale. That is Trey Abshier. Trey, welcome to the program. Thank you so much for coming aboard. I really appreciate it.
Yeah, thanks for having me.
And we're going to, like I said, get right to it because there's a lot going on at your hospital, and it's a big hospital. I've been there many times. But one of the things I don't want to forget, one of the things over the last year and a half was the Humana insurance, which I know a lot of people in South Florida had. They actually, and maybe clear this up, they were dropped a few of the hospital networks, not just Tenet hospitals, which you're associated with, but other hospital networks I had heard. And now, I think starting maybe last August, about so.
June, yes.
June, okay. That sounds about right. And then, so now Tenet hospitals and especially Florida Medical Center are again taking the Humana patients. Is that correct?
That is correct. I believe we were out of network as a company for close to 10 months. Very painful situation for both parties. But as of June this year, all of Tenet, and most concerning to me, of course, Florida Medical Center, are back in network with Humana and are able to take all Humana patients.
All Humana patients. That's
Correct.
great to hear. I knew something was up when my mom called me and said, all my friends at Bingo are telling me that Tenet dropped Humana. I said, Mom, I don't think Tenet dropped Humana. I think it maybe was the other way around. Certainly. So that's good to hear. So, Florida Medical Center, as you take, I'm sure the whole gamut of insurances, that must be some list there.
It certainly was. And it turned out through this process, we learned that the epicenter for Humana was Broward County. So Florida Medical Center felt that void dearly for those 8 months that we were out of network.
That long. Well, we're back in network now. It's good to see. And it's right. If you have any questions about that, I know where I found the latest information was Florida Medical Center's website. It's right there in the front, back in network. Good news for Humana patients. And you can actually click there to learn more. One of the things when I was kind of joining the South Florida health landscape, as a lot of people know, I came over from Sun Sentinel. I was a reporter. When I first had seen the name Florida Medical Center, I had always associated it with a kind of another hospital in my mind. But then as I was there on the campus for the first time, I was like, that's the hospital I drive by on the Turnpike that has the Heart Institute on the back end. And then what I wanted to ask you is actually Florida Medical Center a campus in North Shore. Why is that? Is it a sister hospital to another hospital in your network?
You could certainly call it a sister hospital. So North Shore Medical Center is a Tenet facility in North Miami, actually off of 95th Street. And I would say 10 years ago, it certainly predated me. I've been at FMC for 2 years this month. A decision was made in our regional offices and our corporate offices to share a Medicare provider number, which is commonly done across healthcare entities. And that decision was made, and 10 years later, it's actually worked out very nicely. North Shore offers services that FMC does not offer. We offer services that North Shore does not offer. And it works a little different than your traditional standalone hospital in that we share a medical staff. So when a physician comes on staff at Florida Medical Center, FMC, they also join staff at North Shore. When we share data with the government, we share as one enterprise. So commonly you'll hear our executive team refer to the enterprise, and that is the combination of both hospitals. So we work extremely close with North Shore's administrative team, with their physicians. There are a number of medical staff meetings and leadership meetings that are joint meetings, and the relationship has probably never worked as well as it does today.
I know you're close to their CEO as well, and we'll have to get him on the program, but this is a first for us, so we're really happy
Certainly,
to join us.
A great addition here.
And as the listeners know, we've had so many of your physicians on this program. I'm thinking of the long list. It's we were talking a little bit before the show, Dr. Neil Galindez. I think he's been on 3 times, the cardiothoracic surgeon.
Sure.
Oh, last week we had Dr. Vanitha Vasudevan, general surgeon, and you mentioned oncology before. Mm-hmm. That's at your hospital. Dr. Kashaw, the interventional neurologist, been on the program.
You've had some fantastic ones.
Dr. Byer, of course, who we always welcome. So you have a great team there. And another thing you're doing great in the community is your connection with the LGBTQ community.
Right.
I kind of... one of the things I read about you, and I actually, one of the people I went to FAU with and studied journalism with is Jason Parsley. He's editor of South Florida Gay News, and they actually ran a report about how FMC had a perfect score in a recent healthcare equality survey. So can you talk a little bit about that and why that's so important?
Sure, and I'll explain how that actually came about. FMC is around 5 miles from the Wilton Manors neighborhood.
Okay.
So 5 miles east of us. And it was a community that we felt was underserved from a healthcare perspective, and that we had something to offer in terms of the services that we provided and the physicians that were on our staff. And through a series of contacts that we had on our staff and people that we knew in the Wilton Manors community, we decided if this was a community that we were going to serve, something that we learned was very important to the Wilton Manors community, who is heavily into the LGBTQ community that it was important for us to offer that equality award. So it consists of sensitivity training amongst your staff, signage, services that you offer. But in order to achieve the certification, you must pass a test with a certain percentage of your staff. So I'm happy to say that 2 years running, we have achieved that designation. We're only 2 hospitals in Broward County can say that, only 4 in South Florida. And it's done great wonders for us. In fact, most recently, we've added a board member, Robert Boo. He's the CEO of the Pride Center, has joined our board for both campuses, both FMC and North Shore. So we work very closely with he and others in ways that we can continue to improve healthcare in that community.
That is great. That's going above and beyond. I mean, congratulations to you and your hospital staff as well. That is really awesome. Let's talk. I've always wanted to have a CEO on because I want to talk a little bit about actually the only part of hospitals I've been in is the ER. And I've been in a lot of them, as my listeners know. Recently went down playing basketball, just turned 40, went down, cracked 2 ribs, and broke my foot in the same fall. So one of the things that they know is I visit a lot of ERs. Normally it's a yearly thing, and you have a great ER, and you actually offer an ER check-in online. How does that work? Because I've never used it myself. I've heard of it, but I'd love to hear how it works.
Absolutely. And not only does FMC offer, but it's a tenant offering for all of tenant's 77 or so hospitals. And you can access it either through an app on your phone or through the website. And essentially the way it works is once you access the app, it asks you to type in some very simple information about your name, your chief diagnosis, or your chief complaint, and it puts you in a line for registration. So once you arrive to the ER, you will bypass the registration process and go back to a room. It's called immediate bedding. So it really quickens the time that you would have to spend in a busy ER and moves you through the process much quicker than you would if you showed up at a hospital ER waiting room and had to go through the full registration process.
Sounds like it's a win-win for both sides, not only your registration side of things, but the patient, because they already know that the information's already being entering into the system. One less thing to kind of worry about.
Absolutely.
Sure, there may be a question here or there that has to be asked at the front, but you're going to bypass, like back in the day when we walked in with, I won't discuss everyone with all the ailments I've had, but, ran into the hospital and had to go through that registration process. So that's great to know. And another thing that I've seen a couple of the hospitals in the tenant network and outside the tenant network kind of build their own emergency center type things. I know you guys have one just south of I-595 in West of Nob Hill Road, which really isn't that far from the studio right here in Boca. Tell me a little bit about that. Is it like an urgent care type facility?
Not quite an urgent care. It's actually called a freestanding emergency department.
That's right.
And there's definitely a difference between that and an urgent care center. So FMC opened a freestanding emergency department August 2 years ago. And for those that aren't familiar with it, think of it as a freestanding emergency department. So we offer 24/7 service. There's a physician present 24/7 to take care of any needs, as well as nurses, phlebotomists, respiratory therapists, imaging techs. We offer CT, X-ray, ultrasound. And the best part about it is it's open 24/7.
That's great.
And fortunately for us, there is hardly ever a wait. If it is, it's a minimum wait. And we're able to treat patients efficiently, effectively. The facility is gorgeous. Once you see the facility, you will not forget it. And it's been a great success for us in a community that we, before it opened, did not have a presence, and that is the Davie community.
Oh, that's fantastic. I've actually seen pictures of it. It's got like a nice like light blue top, and then you can actually see a picture on the Florida Medical Center website. That's FloridaMedCTR.com, and it's like it's got a very island feel to it a little bit.
It does,
but it's a beautiful modern building. It really is. So I'll have to check that out if I'm ever in Davie. Take a look. And wow, a presence in the Davie community. We've had so many of your doctors right here on the show in Boca as we broadcast over into Broward County as well. But the Florida Medical Center has a huge reach. It really does. And as I was telling you before, I knew of it as the Heart Institute when I would drive down to Dolphins games with my family, and I was always wondering. And then 2 and 2 put together where it is today. I want to take a quick break, and on the other side, I want to talk to you about a lot of the changes going on at FMC. How it's still Broward's premier heart hospital. I know it has a lot of history as a heart hospital in Broward. Also about your ortho program, the neurology program, and a little bit about COPD, because it was just COPD Awareness Month. And I didn't know a lot about this disease, but this disease is really growing fast on the You and Your Doctor show. And we're going to come right back and talk about those topics with CEO Trey Abshier.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And we're back with CEO Trey Abshier from Florida Medical Center, campus in North Shore in Fort Lauderdale. Their number is 954-735-6000, located at 5000 West Oakland Park Boulevard in Fort Lauderdale. So you can actually take the Oakland Park Boulevard exit off I-95, take it right up until you get to just about the turnpike, and it's on your left, which will be the south side of the road. Not sure the turnpike exit, but I'm sure it's pretty close to there as well. So Trey, one of the things I wanted to talk a little bit about is, like I said, I've been gone to Florida Medical Center a few times over the last 4 years. I noticed recently the building's got a fresh coat of paint, and that has really made a difference. I mean, it's really opened up the entranceway into the hospital as well.
Yeah, so about 2 years ago when I started, one of the complaints that I would receive routinely from the community or physicians was that our community did not feel that we offered high-quality care because of the aesthetics of the building, which was not true at all. But unfortunately, perception at times is reality. And the building is not a young building. It was built in 1973. So every few years, it's required for some significant upkeep and maintenance. And so we decided to repaint the building to just a more fresh, modern look. We also decided to upgrade landscaping, signage, and just give it a fresh new look that every once in a while, like I mentioned, a hospital needs to see occur. And it turned out, in my opinion, and I'm glad you share the same sentiment, fantastic. I do not receive those complaints any longer as it relates to the aesthetics of the building. Not only the exterior, we did the same on the interior. So I'm very happy and proud that the campus looks the way it does. We're continuing to improve it each and every day. But we as a leadership team and a physician medical staff certainly enjoy coming to work and seeing that building each and every day.
And throughout the entire hospital as well, I've met a few doctors there prior to them coming on this show. Let me tell you, that place, it just shines. It's like, I don't know if they hit it with spick and span every day, but there's some areas. I met Dr. Bayron, who's a friend of the program, outside the bariatric center there a few times, and I was just amazed at how clean that hospital was. So that's another kudos to you and your staff on that as well. Another thing that you've introduced is, and I'm a reader, is Trey's Tribune. As you can see, if you're watching on YouTube or Facebook Live as we're broadcasting, that is like a little newspaper that you do. What's about once a month?
Well, every other week.
Every other week.
Every other
that
Thursday
much.
It comes out.
Yeah, and I always check it out. I actually print it out. It has everything from physician spotlights to spotlights of some of the things patients are saying about your hospital. I know you're involved in a lot of events there, more so than a lot of other hospitals, I got to say. So that talk a little bit about Trey's Tribune, why you started it, and look at that holiday bake-off, bake sale in the medical staff library.
Yeah, absolutely. And it's been a huge win for us. And the reason it was started, to answer that question, was we can never as a team do a good enough job communicating. We communicate 7 different ways, 7 different times. But one way we like to communicate is through a message or others dubbed Trey's Tribune, to try to make it as catchy as possible. And we decided that every other week we would share information about events occurring at the hospital, ways to get involved in different community outreach programs. We highlight a physician, we highlight a staff member, we highlight a department. Anytime someone new comes on from a leadership perspective, we highlight their achievements, where they came from, what they're bringing to the table. We talk about accolades, accreditations, certifications. It's just a great way for me to communicate to, I think the last time I saw that message goes to over 2,000 people. So not only does it hit the 1,000 employees that work at FMC, the 500 physicians, but you yourself receive it who do not work there, along with hundreds of other people that have asked to be added to it because they want to see the good work that's happening at the hospital. So every other week it goes out, and I now see that we're on our 48th edition, which is incredible to think of.
It's fantastic.
But a lot of work goes into producing that, but we never have a shortage of content, I will tell you that.
Yeah, I think it's 48 pages this month or something like that, close to it.
That's an incredible amount of information to share.
That is. And how can people, if they want to sign up, they sign up through the website, or they can just, I see on the front of it, there's a Facebook, Instagram, and Twitter logos there.
Yeah, I mean, that's a good way. And there's actually an email in there, and they can email that individual, and we can add them to the distribution list, and we can give that information out as you see appropriate, the appropriate way to do it. But that's the best way to get added.
So we're on Facebook Live, so you can just type it into Facebook. That's the way.
Yep.
That'd be very easy. And one more thing I want to point out about it. This is so in depth that, like, one of the items is the dome light for the new nurse call system on the 5th floor, and then there's a picture of the dome light and then a little bit about it. Like, you're actually telling all your physicians, staff, patients about every upgrade, new landscaping on the certain side of the hospital I just saw here. That is really neat as well.
Yeah, well,
that's unique.
Right, and that comes from staff feedback. So when we receive staff feedback, such as the dome lighting, which many may think is a very minuscule detail to communicate, but we want to make sure that we're following back up with our staff. It does us no good to take feedback if we're not going to do something with it. And this is our venue and our way to communicate that we've listened, and this is what we've done about it.
And just to start, thank you to everyone who donated shoes as part of the behavioral health shoe drive this year. FMC staff has collectively donated over 75 pairs of shoes for our behavioral health patients. Those are just kind of stories you're going to see. Really neat. Great job with that. I had to point that out because that is very unique. And like I said, pointing out things like the dome light as well. I haven't seen that before, so very unique as well. Another thing I want to talk to you about is it's been in the news, a new cath lab, and I know this hospital is known for its heart care since the beginning in 1973, right?
Absolutely. In 1973, when the hospital opened its doors. In 1974, they were the first hospital in Broward County to perform open heart surgery.
Wow.
And from that point forward, FMC has predominantly been known as a cardiac facility. Now, we do some other things very well, but that is what the hospital has been known for quite some time. And we continue to invest, as you mentioned, in the cath lab, which is opening this month, a brand new cath lab. We recently opened a new EP lab, $4.3 million worth of equipment, state-of-the-art equipment and construction. That opened 3 months ago. So we're continuing to invest in our cardiac program. It's what's got us to the point where we're here today, and it's going to continue to be a market leader for us in Broward County.
That's great to know. And one of the things that has been in the news the last few years is AFib treatment. And then I've learned over the last year doing these radio shows with having everyone from neurologists to cardiologists to cardiac surgeons on is how, if atrial fibrillation isn't treated, it could actually cause a stroke or other ailments. And I know that is one of the huge undertakings that you and your staff are going on is becoming a leader in AFib treatment and cardiac care at the Heart Institute of Florida. It's still called the Heart Institute of Florida there at Florida Medical Center?
It is.
Okay, that's good to know. And so the cath lab is part of that treatment as well. I know other treatments go on as well with interventional cardiology.
Right, cath lab, EP, surgery, all fall under the brand of the Heart Institute of Florida.
Oh, that's fantastic. And like we mentioned before, cardiothoracic surgery. We had the cardiothoracic surgeon on here and interventional neurologist Dr. Velasquez. We're going to be having him on in the future. I know he wanted to come tonight, but he was a little busy, so we'll have him on the future. He's actually been on this program once or twice. And I know you have a great orthopedics program as well.
We do.
With a lot of the orthopedic surgeon, sports medicine specialists right there with their offices right there on the campus of FMC as well.
We do.
So that's
we
huge.
have a sports med physician, Dr. Moheden,
Yep.
who offices on the FMC campus, who is very busy at our facility. A great individual as well. So that makes it even better to work with.
He trained with the Miami Heat.
He was the trainer for Miami Heat for quite some time, and we were happy to recruit him and join the FMC staff. So he's been a great addition to the team, as well as Dr. Burke, who has a presence on the east side of Broward County, performs a number of total joints and hips for us on a weekly basis. His results are incredible when it comes to total knees and total hips. His patients have surgery on a Wednesday, and they predominantly go home the next day, which is unheard of. So he is an incredible surgeon that is well known and has been an incredible addition to FMC.
That's Dr. W. Vincent Burke.
That is correct.
On staff at Florida Medical Center, and also his office is at Florida Institute of Orthopedic Surgical Specialists, FIOS. So if you're looking to look him up, maybe if you save this show or you're looking after the show airs as well. Another huge program at the hospital is the neurology program. And then something I learned in the last 5 years as well, medicine is moving so fast, is interventional neurology. You have great programs for that as well.
I do. And you mentioned Dr. Mueller, who's been supportive of FMC for quite some time, who is a regional medical director for us in South Florida for Tenet. And I'm happy to say that in July of this year, we added to staff a interventional neurologist by the name of Dr. Wilson Cueva. He, you could say he lives at FMC. He's there 20 plus days a month to treat stroke patients. So it's been great having him, because when it comes to stroke, it's all about time and brain, and time is brain. And he being stationed at FMC, along with our mid-level practitioners and other critical care nurses, we have seen tremendous results when it comes to stroke treatment for our patients in our community.
That is great to know, and I know you guys have won a lot of awards as well over the years for that. So you can look all that information up on FloridaMedCenter.com. That's the word Florida and then med, MEDCTR.com. Or you can call FMC at 954-735-6000. I wanted to ask you, because it's been in the news, and I'm not sure how it really works in terms on the hospital side, but what is a readmission? And then to take that a step further, what is your top readmission at the hospital?
So the way the government and the way we focus on readmissions is within 30 days. So
Okay.
a patient is treated at the hospital, they're discharged, they go, whether it's home or skilled nursing facility, whatever the case may be, and they end up back in our hospital in less than 30 days, we're penalized financially by the government.
I did not know that.
And so that has been in place for quite some time. It's certainly a focus of all hospitals to prevent readmissions. So we work very closely with home health agencies, with skilled nursing facilities, with assisted living facilities, nursing homes, to ensure that we're all providing the same standard of care. So we provide a lot of education to those facilities to ensure that they're delivering high quality care, because FMC is surrounded by 80 plus post-acute facilities, so your SNFs and ALFs and nursing homes. So we work very closely because they end up getting a number of our discharged patients, and we want to ensure that they're providing great care as well as we are. Our number one readmission is COPD, chronic pulmonary disease. And so it's a struggle for us, and we've put a number of initiatives, ideas, processes in place to ensure that those patients, once they are discharged, they are followed up with, and they're getting the correct care that they should be receiving at whatever facility or home they are going home to.
That's great that you're making an effort to help people after they get out of the hospital, because, you definitely want to get back into the quality of life and back to family and friends. What is your feeling on home health to cut readmission costs?
Well, I think they're instrumental. We work very closely with a number of home health agencies because they can provide clinical support at the home that we cannot provide otherwise, to ensure that those patients are taking their medications, following up to see their doctor, and it's a level of care that the hospital can't provide. So we partner closely with home health agencies to help with that very issue.
Now, I always like to throw a last question curveball at the end. What are your hobbies and passions outside of medicine? Because just like a doctor, your life is consumed by medicine as well.
Certainly
I'm not laughing about that. I'm just saying.
No, you have to laugh. It's certainly all consuming. It's a difficult industry, very complex, extremely regulated. I don't know if you call it a hobby, but I have a 18-month-old at home. So,
congratulations.
So that's
I have a 5-month-old.
That certainly keeps me busy, and expecting another in April.
Fantastic.
So I don't know that hobbies are going to be occurring anytime soon, but
Not
when
anymore.
I can get away, I do enjoy golf. Unfortunately, don't ever get to play enough to get any better, but I do enjoy getting out there and swinging the sticks.
Here in South Florida, we got to get you out as well. You're in the golf mecca of the world.
I have enjoyed some, just never enough.
And we were talking a little bit in the green room before, originally from Louisiana and went to LSU.
That's correct.
That is fantastic. What is it like growing up in that football state? Because we're in the football paradise right here, but man, it's taking it to a different level. Death Valley, right?
I would challenge you about football paradise. There is nothing like going to a game in Death Valley on a Saturday night watching the Tigers play.
I got to get there. And I've been to Clemson once, so I got to get to LSU.
Yeah, you got to the other Tigers. Yes, you certainly could. Definitely make a point to do that.
And even some of the other teams down there. I mean, Louisiana Lafayette, we were talking. I've been there a few times. And Monroe, Louisiana Monroe, which is now known for Duck Dynasty, but when I was there, was known for the Louisiana Monroe Warhawks. And, man, they had a team. And what a great state to visit, as I was telling you. I've been to New Orleans 5 times. I love Lafayette, Louisiana, and Préjeans. And you're originally from?
Baton Rouge.
Baton Rouge. And we say New Orleans or New Orleans?
I say New Orleans.
Yes, I had it right. So I haven't been butchering it too bad. Well, thank you so much for coming on the program and telling us so much about FMC. We've heard so much about the hospital, but to hear it from you is just truly fantastic. Like I said, keep up the good work. And anytime you want to come back on the You and Your Doctor show and CEOs, we can add that in there. Please feel free if you ever have any new news or
Absolutely.
just want to say hello.
Thanks for having me. Enjoyed
Thank you. And thank you for making the quick drive over. FMC is only about 30 minutes. You made it less than that.
I did.
During rush hour.
It was easy today.
Yeah, so it's right around the corner from Boca. And join us. Stick around. We have a GI doctor on the You and Your Doctor show.
All County Healthcare, Inc. is located serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your All County Healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Beyond, and welcome back to the You and Your Doctor show. So the second half of the program, I've actually done this show for a year, and I've never had a GI doctor. We had actually a hypopancreatic biliary surgeon on. So I know that's kind of near what you do, Dr. Wick, but I definitely want to have a GI on the program. So I just wanted to welcome you. This is Dr. Andrew Wick, and you're on staff at Delray Medical Center locally?
Yes.
And right around the corner?
At Boca Regional Hospital.
Yeah, which is, we can almost throw a stone and hit it there.
Absolutely.
And I know you've been at some other hospitals in the area as well. Mm-hmm. And now you are a GI doctor, and we know that as gastroenterology, but what actually is a GI doctor, and what is the area of the body that you diagnose and treat?
Well, as the name implies, gastroenterologists treat diseases of the digestive system. That includes the esophagus, the stomach, the intestines, as well as associated organs that help the digestive system, such as the liver, gallbladder, and pancreas. So we have a very broad range of organ systems and disease entities that we treat.
Yeah, which is a huge system there. Now, we've talked a lot about the gallbladder on this program, and it seems like all the women in my family have had gallbladder surgery. Why is that? Do women get it more than men? Gallbladder issues?
Women seem to get more gallbladder issues per men, but it does affect men and women of all races, all creeds. Partially, it's due to hormones, and partially it's due to fat storage in the body. Partially, it's due to metabolism, and also somewhat due to genetics. If you have a mother, sisters, brothers who have had gallbladder issues, it may tend to run in families that you will produce gallstones and or get gallbladder disease.
I see. And I've seen that actually with my family, so it must be genetically running through the family, as you said. I always have to ask that question because I just found it fascinating. It just seemed like more women than men. But that is a great, that is medicine-based there. I was
absolutely. Yeah, I can't give you the statistical numbers on men and women, but it does seem that we see a little bit more gallbladder women women having that problem more often. Yes.
Now, what is the most common ailment you see as a gastroenterologist, or GI as short as we can call you GI?
GI is fine.
Okay, good. Thank you.
In the community practice, in my office, and I think it's universal, across the country and the world, the most common ailments that we see are the ones that you know best of all: the heartburn and reflux problems related to bowel issues. I move too much, diarrhea, I can't move enough, constipation, chronic unexplained abdominal pain is a common issue. We get into some of the more exotic diseases that we'll treat: inflammatory bowel disease, allergic esophagus, pancreatic and liver diseases. These days we treat quite a bit of hepatitis, which of course has been a scourge since the 1990s. Fortunately, we have excellent new treatments for that we hope to eradicate the disease from the face of the earth within the next several years if we're lucky. So
that's hepatitis?
Hepatitis, yeah.
Wow.
But the common things are common everyday ailments that people just can't manage on their own, and that's anything related to the digestive tract. Upset stomachs, chronic nausea, gas, bloating. These are all the common complaints that come through the door of the office, and sometimes they're simple issues, sometimes they're a sign of more complex disease.
Well, that's really good to know. That is, there's a lot going on with the digestive system, and as the listeners know, we've talked about on this program before, but I don't think we've ever got in depth as we're going to get tonight. Now, I started out about gallbladder because that was my personal question, but now you're a GI, so you diagnose and treat the digestive system, but you wouldn't be the doctor who would take out the gallbladder, but you would help to start that investigation process, and then I guess refer to a general surgeon. Is that how that works?
Absolutely. Gastroenterologists are usually the specialty that is called upon to diagnose the ailment. So when a patient comes to us with a particular problem, we have at our disposal many diagnostic aids and ways to figure out what's going on. Foremost, of course, is our education, understanding physiology, the body, digestion, anatomy. And so after we sort of put together a good story from a patient, what's happening to them, we may then, lean on diagnostic testing, blood work to evaluate the metabolism, the liver functions, if patients are anemic, their blood production. Then we go to diagnostic tests in radiology, common things like ultrasounds, CAT scans, MRIs. And then we go on to even more sophisticated types of diagnostic tests that gastroenterologists do, including endoscopic ultrasound and a test that we use quite a bit for the pancreatic and biliary system, which is called ERCP. It's an abbreviation for endoscopic retrograde cholangiopancreatography, which is a big mouthful, so we call it ERCP. That's where we are able to access the bile ducts of the liver and remove stones that come from the gallbladder, to drain infections, to stent blocked up ducts, sometimes from tumor or infection. So there's a lot of things we can do endoscopically with our tools and our therapeutic devices that can actually keep you away from surgery. But yes, if you've got a sick gallbladder, we turn to our friends, the general surgeons, for a cholecystectomy or removal of the gallbladder when it's necessary.
Okay, so one of the procedures, like you said, you do is the endoscope, and that goes through the mouth and into the stomach. Is that how that works?
Commonly called endoscopy or upper endoscopy. In medical problems, we call it an EGD, esophagogastroduodenoscopy. Esophagus, gastro, stomach,
I read that in my research.
duodenum, so we call them EGDs. That's the upper endoscopy, where the patient is sedated. We pass an endoscope through the mouth, down the esophagus, through the stomach, and into the first portion of the small intestine. We have devices and scopes that are even longer that can actually now reach through the entirety of the small intestine, all 20 feet of it, or better.
And then now when you say scope, is that a camera on the end of that? You're seeing that on the screen, or how does that work?
The endoscope is a very sophisticated device. People think of it as kind of like a fiber optic camera, but it's really not. What the endoscope does is it has a light on the end of it that sprays the whole spectrum of light across the field of vision. and then that light is reflected off the surface of tissue, the inside of our bodies. And sensors at the end of the endoscope then take back those wavelengths that are reflected, and a computer recreates an image of the body that looks like a very precise video image, but it's not quite a direct video image. It's a computer recreation, but it is as exacting as a fiber optic camera.
Huh. I did not know that. I'm so glad I asked that question.
Yeah. They're actually very sophisticated devices, but very commonly used.
Mm-hmm. And with your training and whatnot, you're able to see the different ailments in the stomach or changes in tissue, I guess.
With training and experience, we're able to examine down to the millimeter per millimeter of the surface of the stomach, the intestine, the esophagus. And there's even more sophisticated types of scopes which can view microscopically, cell by cell.
Wow.
But you only find those usually in university settings.
Yeah, definitely.
Yeah.
In academic settings. Now, you mentioned that you're talking about the digestive system 20 feet long. I did some research as well. That was one of the questions I wanted to ask you. It is that long?
Well, from mouth to anus, in most human adults, it's about 30 feet. The large intestine runs about 4.5 feet. It's approximately, perhaps 2.5 feet from the mouth to the bottom of the stomach, sometimes less. And everything in between that is small intestine. So about 20, 25 feet of small intestine.
Unbelievable. I did not know that was going on in the body. And that is a lot of tubing
inside
there.
Our bellies. A lot of tubing.
Well, we're actually going to take a quick break here. And on the other side, I want to talk to you a little bit about, we hear a lot about it in the news lately, but actually a famous guitarist has the disease. And if you want to hear about that, join us back on the other side on the You and Your Doctor show.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
And the show is now talking about GI care. Is something that we haven't had on the show, so I'm very glad to bring you that kind of info. And right before the break, I was telling you, as you, the listeners all know, I'm a huge Pearl Jam fan. I've seen them 22 times. I live to emulate Mike McCready. He's my favorite guitarist in the world. He's amazing. And I've been following Pearl Jam since about 92. And about 10 years ago, I was reading an article about Mike McCready having to run off stage full speed and get to a bathroom. And then he opened up about Crohn's disease. And as you know, Pearl Jam's been done pretty well. And one of his things is he raises money for Crohn's disease awareness, research, etc. And Dr. Wick, I wanted to ask you about Crohn's disease because we hear a lot about different diseases, but this is one disease that I can't tell you really. I've heard much about it in the news except for finding out about Mike McCready. What is it, and how does it affect the digestive system?
Well, Crohn's disease is one of the two inflammatory bowel diseases. They're, in a nutshell, they're related, but Crohn's disease can occur anywhere from the mouth to the anus. So you can get disease in the esophagus, the stomach, the intestines. The most common site of the problem in Crohn's disease is the far end of the small bowel, which we call the terminal ileum, and various parts of the colon, especially the rectum. Ulcerative colitis, which is a related disease, only affects the large bowel, the colon. And it's just a mucosal disease, ulcerative colitis. It only affects the lining. So symptoms from that include belly pain, diarrhea with bloody stools, weight loss, and it's a horrible disease to have. Crohn's, however, is perhaps even more horrible. It's more insidious because Crohn's can affect various parts of the digestive tract, and it's a penetrating disease. The disease causes inflammation to go through the lining from the very inner mucosal layer lining inside your gut through the wall of the digestive tract. So you can actually have disease extending outside of the bowel into adjacent organs. We call that fistulizing disease. You get communications, openings between different parts of the bowel sticking to each other and opening up into each other. Therefore, you get formation sometimes of abscesses and bleeding and diarrhea because you have liquid stool that can come from the beginning of your bowel suddenly transferred via fistula to the bottom of your bowel without any water absorption. So you get horrible diarrhea. It's a very bad disease. Fortunately, although science doesn't have all the answers, we're learning more and more about it every day, and we're coming up with better and better treatments for this disease.
Now, they sometimes loop Crohn's and celiac disease kind of in the same sentence. Are those kind of on the same kind of wavelength there?
Actually, they're very different diseases.
Wow.
Celiac is a different disease. Celiac disease is a allergy to a protein commonly found in wheat. We call it gluten. Mm-hmm. Okay? And that is an allergic response to gluten when it's in the gut, which causes problems related to inflammation in the small bowel and destruction of the structure of the small bowel so you can't absorb things as well. There are other related problems to having celiac disease, but it's a distinct disease and is actually fairly easily treated by avoiding gluten in the diet.
That's why we see gluten-free all over the place now?
Right. We see gluten-free everywhere. The disease has been around for a long time, but it kind of became somewhat of a sexy disease in the late 90s and on. As it got more attention and more people learned about it, we started testing for it. It's always been there, but doctors didn't test for it regularly, didn't think about it as a cause of many of more common ailments that we get. So as people became more and more identified as having the disease, there became a need for more ways to treat it. A gluten-free diet to avoid the allergen, the part of the protein that causes the allergy, is very difficult for a lot of people to maintain. So over time, people have devised more and more gluten-free foods, better tasting gluten-free foods, because originally one of the problems was that the diet just didn't have a lot to offer as far as, substitutes. I mean, if you tell the average person you need to avoid bread and wheat and barley and rye, which are the grains that have gluten in them, that's difficult to avoid. Anything with flour or has come in contact with flour. So as time's gone by, there's been more development of more resources for gluten-free foods. This is not to be confused, though, with something that's also a newer fad, and that's the concept of gluten sensitivity. Many people go gluten-free diets even though they don't have celiac disease. They don't have the allergy. And you can test patients with a blood test fairly easily to see if they have the allergy to gluten. But some people just feel better with gluten not in their diet. They digest better. Some people get a headache syndrome. If you give them a gluten-free diet, it goes away. Some people have respiratory problems that get better if you don't be on gluten, although they're not allergic. They're what we call gluten sensitive. I believe that would be the appropriate term that we've adopted now, gluten sensitive people. So quite often when people have conditions that are not allergic to gluten, we may suggest a trial of a gluten-free diet to see if it helps their problems. And this is becoming a more accepted concept in medicine. For a while, it was kind of thought to be, more of a mass hysteria phenomenon that everyone thinks that they actually have gluten problems when they don't. But as it's turning out, there is a small subset of people, not everyone, that are truly gluten sensitive, and therefore will do better by avoiding gluten. And doctors now are recognizing this, and we're more accepting of a patient who says, "Doc, I can't eat gluten, it bothers me." And you'll test them, and they don't have celiac, and we say, "Nah, you don't have a problem," but the truth is that they might.
Gluten sensitivity.
Gluten sensitivity. So in the therapeutic trial world, it's not a bad idea sometimes to try a gluten-free diet, but it's actually a rare phenomenon to find someone who truly is gluten sensitive. There's still a lot of people who swear by a gluten-free diet, although it may not always fix their problems.
Yeah. And I got to tell listeners and viewers, you are not going to get an explanation on gluten-free and gluten insensitivity like that anywhere else than you just got here on the You and Your Doctor show. That was fantastic. Dr. Zwick, I don't want to leave before talking a little bit about acid reflux and one of the new procedures you're doing at Delray Medical Center. Let us know about this new technology for digestive care.
Okay, certainly. As I said before, probably it is actually the most common problem that people come to a GI doctor for is heartburn and reflux. For a long, long time, this was battled by the theory of modifying the diet, staying away from foods that induce heartburn and reflux, the common things such as spicy foods, fatty, greasy foods, alcohol, chocolate, mint, caffeine, and of course, everyone's favorite Italian food. When you're doing experiments on trying to help reflux, the way you would take a volunteer patient and induce reflux is give them a pepperoni pizza and a Coke.
Oh, gosh.
And then you can certainly see reflux in almost anyone after that. And so for a long time, people have battled this with diet, but diet doesn't always work. Mm-hmm. Sometimes you need something more.
We have a minute, and you can tell us a little bit about that procedure. Well,
what we have now is a procedure we're doing at Delray Medical Center called the TIF, the TIF procedure. It stands for Transoral Incisionless Fundoplication. It's a way for doctors like myself to endoscopically, that is, going down the esophagus with a device to fix small hernias where the stomach pulls up into the esophagus, and then wrap the top of the stomach around the distal esophagus to form a tight barrier that keeps acid and stomach contents from coming up. Traditional anti-reflux surgery is invasive, has quite a bit of complications to it. But with the TIF procedure now that's being done at Delray Medical Center, we're able to take people who either are not getting satisfaction in their diet or meds and help them get rid of the reflux without pills.
Thank you so much, Dr. Zwick. You have any info for Dr. Zwick, check out delraymedicalcenter.com. Thank you.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.
The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.